So weird.
Back to it.
It's so weird.
Yeah.
We haven't, last upload was like 4 months ago.
Yeah, so that means we haven't recorded in like 5 months.
Yeah. 4 months.
4 months, yeah.
Right, you're out of it.
Yeah. It's been a long 4 months.
I feel like that scene from Interstellar where they get back to the ship.
Oh
And
yeah.
it's been like 23 years.
Yeah.
Yeah. How's life, bro?
Honestly, bro, I'm just trying to get past the semester. It's been a tough semester.
Yeah. Can't relate.
Yeah.
Respectfully.
Valid. How's how's work been going? How's lifting been going?
Lifting is slowing down.
Mm-hmm.
I think this past Monday I worked out,
Yeah.
and that was it.
Oh dang.
Yeah. Like I kind of like I was just so exhausted after this week of work, and I was just kind of like, "All right, I'm gonna just take this week off, kind of thing.
Yeah.
Um, but yeah, like when I was unemployed for like a month and a half,
Yeah.
I was literally like only going out and to the gym. So I was literally just like sitting on my ass either on the game or looking for a job. And yeah, I gained a lot of weight though.
Yeah.
I got up to like 156.
Oh dang.
At least for me, that's heavy
Yeah.
because I've always been like, 135, 140
Yeah.
back in high school. So it was like getting up to like that. I was just like, dang, I feel like big right now. Like I felt good because I was like, oh, I'm getting big muscles. I'm on whey protein and creatine, but
Yeah.
I just knew I was just like, all right, I'm gaining this weight just because I'm sitting around. And as soon as I got this job, it was like now I'm losing all the like water weight and stuff like that.
Yeah.
And it's not like it's not a hard job. It's just like imagine you were doing like dumbbell curls
Mm-hmm.
with 5 pounds for like 8 hours.
Oh, it's just tedious and annoying.
Yeah, it's just like this long period of time where you're slowly just like doing these movements that's
Mm.
over time working your body out.
Yeah.
That's what's kind of like weird. It's like these long endurance kind of shifts.
Mm.
That's what just makes it's what throws me off about like because I'm tired. So it's like trying to eat right and lift right during that.
It's hard to do.
Yeah, it just like messes with me.
Yeah.
So that's how lifting's going. So work is fine. Work
Work is work.
work is work. Yeah,
Yeah.
that's about it.
For me, ever since like our hiatus, I've been like, I don't know, bro. I've been getting really frustrated with like watching all these IG reels, like these TikToks of like podcasting, just because there's certain people that are like getting popular and famous on saying some BS when it comes to like science stuff, because we're learning about the stuff that they talk about. So
Hmm.
for example, like there's this one guy. So he has his doctorate in something, but like the stuff that he be saying is some BS sometimes about like how you can control your thyroid right away, like just by changing like the way you eat. It's true to an extent, but like what if you have a tumor in that area? How are you gonna change the way you eat based off of that?
Yeah, I could see that.
So I was just like, and then that's when I texted you about it, where I feel like we would enjoy recording more, or I would enjoy recording more if like I follow like the famous technique, which is basically just like where whatever I learn in class or like whatever I'm learning and like what I'm passionate about,
Hmm.
I basically just speak it to you and like teach it to you.
Yeah,
And I feel like it would just be better for our content too.
yeah.
Um, but yeah, ever since I saw that, that's why I became like,
No, I don't know what just happened. I'm gonna turn you up. Hold up.
yeah. Okay, I'm good. Hello, hello. Yeah, there we go.
Try just like connecting it. Try just like putting it in there in case it's loose.
There we go.
Yeah,
All right. Yeah, so that was just a
I think you're a bit.
little loud.
Try now.
There we go. We might have had an issue with the XLR cable. It's okay. Anyways, so the one I don't know what to talk about today, just because I haven't really. I'm like in the middle of like an exam prep. I have an exam Monday,
Classmates gonna watch this and get all the answers.
basically. So we're learning about the respiratory system and then like how blood gets like so like the birth and death of blood, like your red blood cells.
Birth and death.
Yeah.
Interesting.
So it's like, for example, like I'll talk about that actually.
All right.
It's actually pretty cool at how it works.
I bet.
So you have this thing. So what color is your blood when you look at it?
Red.
Red, right?
Yeah.
Pretty simple.
Yeah.
So when you look at the blood, you're looking at the hemoglobin. And hemoglobin is basically this thing that's found inside of your red blood cells, right?
Okay.
So we're gonna go back to like high school bio real quick, all right?
Mm-hmm.
So the one thing that we learned in high school bio was that every like cell or like every type of cell has a nucleus, right?
Right.
And then what is like the nucleus is just like the center area and it has like all of like the genetic material and all that stuff, right?
Right.
So that's very similar to everything inside the body except for the red blood cell. The red blood
Mm-hmm.
cell does not have a nucleus or any type of organelle.
Is it like its own separate thing to?
Yeah,
It's just by itself.
yeah.
Okay.
So the reason why is basically like scientists don't know this yet still, and like they're still doing research on it.
Mm-hmm.
But like obviously you can still make assumptions and you can still like basically make educated guesses.
Yeah.
And the educated guess that we came up with and like what scientists are basically going towards is that it's so that there's more surface area found on that red blood cell for more oxygen to bind.
Mm.
Yeah.
Okay.
So let's talk about the birth of like blood and how it works.
Yeah.
So with blood, we know that it's red, and there's two things that comprise your blood.
Mm-hmm.
It's plasma, which is just like 80% water,
Yeah.
and then everything else, which is like the cells. So like you have platelets, you have red blood cells, and you have white blood cells.
Mm-hmm.
So in the plasma is like the liquid stuff, the
Yeah.
stuff that you feel, and like the stuff that
Mm-hmm.
like when you bleed, that's what you're looking at as the plasma.
Yeah.
And then the redness is the red blood cells, obviously, and then you also have white blood cells.
Mm-hmm.
So I'm just gonna go into more of the red blood cells than the white blood cells.
Mm-hmm.
Um, the red blood cell, it looks like a donut. Best way to describe it.
Right.
It is a circle and it has like a little indent in the inside, like right in
Yeah.
the middle of it, right?
Holds the oxygen, right?
Exactly.
Yeah.
So
I know a little
look,
bit.
look at you.
A
Okay.
little something,
Okay.
something.
Yeah. So you have this thing called hemoglobin found inside of every single red blood cell,
Yeah.
and each hemoglobin has 4 oxygen binding areas.
Mm-hmm.
So what happens when you breathe? You breathe in, you breathe out, right? So when you breathe in, now you have oxygen that's getting carried into your blood vessels, right? This is not like obviously true because we learned that you don't breathe in oxygen, breathe out carbon dioxide in my class.
Mm-hmm.
It's whatever they teach us is not true. And what
So what
we
do you
actually
breathe in?
air, literally just air. Think about it.
So what do we exhale?
Air. Isn't that crazy?
So there's no oxygen and
There's no
then carbon
oxygen.
dioxide.
Yeah,
It's just
right?
air.
Yeah, because think about it. The atmosphere that we breathe, the one atmospheric pressure, 760 millimeters mercury, the stuff that pressure that we're feeling, it all comes from like our air that we breathe in is nitrogen for the most part.
Mm-hmm.
And we don't use nitrogen in our body as like as much as we use oxygen.
Yeah.
And only like 0.5% or like 3% or something like that is carbon dioxide. Everything else is oxygen.
Mm-hmm.
So when you breathe in the air, right? What your lungs do is really cool. I'm not gonna lie, it's actually so cool. So you breathe in, right? Let's say you breathe in through your nose,
Yeah.
and you have like a whole filtration system that goes through your nose where it warms up the air so
Mm-hmm.
that you can go like so it doesn't feel uncomfortable.
Yeah.
You have a filtration system that catches everything like that's foreign, um, like your mucus and all that stuff. That's what
Yeah.
catches it,
Mm.
and it also does it also adds moisture to the air, if that makes
Okay.
sense, like
Yeah. Yeah. Yeah.
water vapor
Right.
basically, right?
Right.
So now you're in your lungs, and in your lungs you have this thing called alveolar sacs,
Mm-hmm.
alveoli, right? And inside the alveoli is where like the gas exchange occurs. So what it does is that it has like this, um, it has amount of partial pressure, if that makes sense.
Mm-hmm.
So there's partial pressure of oxygen and partial pressure of carbon dioxide that we look at. So in the 760 that I was talking about, the 760 millimeters of mercury that I was
Mm-hmm.
talking about,
Yeah.
out of that, 100-ish millimeter mercury is oxygen,
Okay.
and then 70 to 40 to 70-ish
Mm-hmm.
is carbon dioxide.
Okay.
Cool?
Yeah.
Make sense?
Yep.
So how gas transport works, so like how diffusion works, how oxygen goes into the blood is off of pressure.
Mm-hmm.
So have you heard of the term like if you have high blood pressure, low blood pressure, stuff like that, right?
Mhm.
Your blood and your gas transport work very similar, where
Okay.
it wants to go from high pressure to low pressure.
Okay.
So the pressure of oxygen is lower in your capillaries or like the area that has blood in it,
Mhm.
so that it can diffuse from a high pressure area to a low pressure area.
Okay.
Does that make sense?
Yeah.
Okay. So that's how you breathe. It's pretty cool on how that works.
Yeah, it is weird.
It's just really complicated too, right? Like it's such a
Yeah.
complicated system, but it's so cool when you think about like you breathe in, you breathe out.
Dude, the body's just so complicated.
Yeah,
I couldn't do
it's
any of that. What
crazy.
you're doing, dude.
It's so
I
crazy,
couldn't do that.
but so interesting too. So like now we're inside the capillaries and we have oxygen found in the blood cell, right?
Yeah.
So now we'll talk about the blood. Back to the blood.
Mhm.
We now know how oxygen gets into the bloodstream through
Mhm.
the capillaries by simple diffusion of partial pressure, increase, decrease based off of whatever we're looking at, right? So inside of the blood, you have plasma, like I was talking about, right?
Mhm.
In the plasma, the first thing that happens is when the oxygen gets diffused, 2% of that oxygen that came in, so like let's say like 100 came in, like 100 grams or whatever, right?
Mhm.
Out of that 100 grams, 2 grams gets dissolved in the plasma.
Mm.
Cool. So it's not that big of a deal, but we just don't
Yeah.
need to know. Like when you look at like the little thing that they put on when you get your vitals done
Yeah, your
and you read
blood
it's like
oxygen,
your
right?
blood oxygen, it's
Yeah.
98%, right? That's why. Isn't that cool?
Interesting.
Yeah.
Interesting.
So now you have 98% left. That 98% is going to go inside the blood cell because the blood cell is oxygen loving. So
Mm.
it loves to have oxygen diffuse into it.
Yeah.
So when it diffuses, it has this little protein structure that like looks crazy. It's called hemoglobin.
Yeah.
And in hemoglobin, it has 4 binding sites for oxygen.
Mhm.
So you can bind a total of 4 oxygens to it.
Okay.
So in the capillaries, you can have almost basically 100% saturation.
Yeah.
And saturation, all that means is the amount of oxygen that is bound to the hemoglobin. So for example, if 3 out of 4 is bound
Mhm.
to that, you're at 75% saturation.
Yeah.
If you only have one bound, you have 25% saturation. Make
Okay.
sense? Pretty
Yeah.
simple. So we're at 100% saturation in the capillaries.
Okay.
Now we're moving throughout the bloodstream through like the heart pumping and like all that stuff. The blood is flowing. All like the red blood cells are saturated and all that stuff. Now you are at the tissues, blood
Mhm.
tissues, skeletal muscles tissues, um, smooth muscle tissues, anything.
What's a smooth muscle tissue?
Smooth muscle is like, for example, okay, so let's look at your arms, right?
Yeah.
You have any veins that pop out?
Not a
Yeah,
like this one back here.
there you go. Okay.
Yeah.
So for that muscle to dilate, or like for that vein to show and like to dilate, you have muscles that surround it. So
Mm.
what they'll do is the muscles will expand or relax, and they'll go like this to allow it to look a lot thicker, and it'll
Mm.
pop out more. It's called vasodilation.
Interesting.
So then when you're
So you're saying there's muscle around it? This isn't like just sitting on top of a muscle?
exactly, it's muscle around it. That's the smooth muscle because you can't control it.
Interesting.
Other types of smooth muscle would be like your so you have transverse muscles, then you have oblique muscles, and you have like all these muscles, right?
Mm.
And they're all found in your small intestine.
Okay.
What they do is they help with peristalsis, so like basically moving food forward.
Yeah, yeah, yeah.
And we can't control that, so that's
Right.
why it's smooth muscle.
Oh,
And
okay.
smooth muscle is anything that you can't control.
Gotcha.
Yeah.
Interesting.
So, isn't this cool, bro?
Dude,
Like
low key.
I'm telling you.
I'm going to college now.
All right. So, now we're at the skeletal or like the tissue site. So like the area where gas exchange occurs. Make sense?
Okay.
So where the gas exchange occurs,
Like farting?
basically,
Hooting and farting?
Putin and farting, right? So like how gas exchange occurs is like like how I have to flex my muscle?
Yeah.
Dude, that's a whole different topic. We can talk about that for hours on how a muscle contracts. It's so cool. But for a muscle to contract and like let's say you're working out, right? You need
Yeah.
more blood flow to that area.
Right.
And if you have more blood flow to that area, you're gonna have more oxygen just
Right.
because your oxygen is dumping
Yeah.
or your blood is dumping oxygen into that area,
Yeah.
right? So if you have 75% saturation, like how we talked about, how many oxygens do you have bound to that hemoglobin? 3.
3. Yeah.
Makes sense? 3 out of
Okay.
4.
Okay. Yeah. Yeah. Yeah.
Okay. So where did that other oxygen go?
The rest of your body?
Exactly, into
Oh,
the
okay.
tissues. Does that
Okay.
make sense?
Okay.
So how does that occur? We talked about this. It's from the pressure influx change,
Yeah.
right?
The little, what do you call it?
Partial
Capillary?
pressure.
Yeah.
Yeah, yeah.
Or
Cool.
the sacs, whatever.
Yeah, yeah.
Yeah.
Cool. So we're back into the So we're in the capillary. So the capillary is like how your blood moves.
Yeah.
It's like what you looked at, that's your vein, right?
Mm-hmm.
The opposite of your vein is your artery.
Right.
So the connection between a vein and an artery, smaller versions of veins and arteries, so people don't really get
Yeah.
mad. But
Yeah.
the smaller version of veins and arteries, the venules and the arterioles, the conjunction between the two is called the capillary junction, right?
Okay.
So that's where we are.
Mm-hmm.
That's what we're looking at.
Okay.
So for this to occur, you have to have smaller partial pressure of oxygen found in the tissues,
Mm.
so that then the hemoglobin's like, yo, oxygen, you got to go. It's got to diffuse.
Mm-hmm.
So it has to be less than 100 millimeters mercury.
Okay.
So we're at around, let's say the partial pressure is around 40.
Mm-hmm.
So that means you can dump the oxygen. Cool. Now the
Yeah.
oxygen is dumped. Now your saturation goes from 100 to 75 in the muscle tissues. So that's how you get oxygen into your blood or into your muscles.
Yeah.
Is basically through that. Now, when that occurs, you're bringing that 75% back up. Now you're a lot weaker than you were as a hemoglobin because you still have a binding site available. So you're going back
Yeah.
up, and now you're back to the alveoli, where
Mm-hmm.
like the gat, like where you breathe.
Yeah.
So now that partial pressure that you had is now lower than 100. Why?
Mm.
Because we got rid of that oxygen, right?
Yeah.
So now it's lower. So if it's lower and the oxygen is higher, what happens? Oxygen can come in,
Yeah.
and now that whole cycle re-begins.
Interesting.
So that's how gas exchange occurs in blood.
That's so complex.
It's so crazy,
Like
and like
why?
we don't even think about it, right?
Mm.
And yeah, so that's how that occurs, right? And then you have like these things called like you have like these different pathos, like basically issues that you can have in your body.
Yeah.
Like for example, anemia. You've heard of anemia?
Yeah. That's where you can't sleep, or is that where you sleep too much?
No, no, no. So anemia is basically it's talking about your blood.
Oh.
So
What was I thinking of?
apnea,
Yeah, that's what I was thinking
yeah,
of.
apnea. So there's this thing called sleep apnea.
Yeah.
So basically, sleep apnea is basically when you're snoring,
Right.
and that just means that you don't breathe when you sleep.
Yeah.
Um, and that just occurs through like obstructive sleep apnea. Just means that you're bigger, like your BMI is higher and you're fat,
Mm-hmm.
so you're gonna have like a lot more constricting your airway. So
Oh,
that's what causes you to snore.
gotcha.
Yeah. Okay. So now we talked about the birth. Oh, we haven't even talked about the birth and death of a cell yet. But that's how the blood works.
Yeah.
We now understand how blood works.
Yeah.
So for example, you go through stuff like this all the time where you get a cut, you start bleeding,
Yeah.
you like for example, I got punched in the shoulder, now I'm bruised and all that stuff, right?
Mhm.
So a, a red blood cell has a lifespan just like us. We
Mhm.
have a lifespan, and the lifespan of a red blood cell is 120 days, so 4 months basically.
Mm.
In between those 4 months, before apoptosis occurs, basically a cell suicide or
Mhm.
cell death, before all that happens, that red blood cell, it gets scribed that day. Like as soon as it gets made, it knows that it's gonna die in 120 days.
Interesting.
Yeah. So how it happens is that you have basically this thing called EPO,
Mhm.
found in your kidneys, your erythropoietin. Basically that's what it's called, right? And what it does is that it creates these red blood cells
Mhm.
using hemoglobin,
Okay.
and hemoglobin is found anywhere.
Yeah.
I'm gonna get into how hemoglobin's found at the death of the cell. It's pretty cool.
Mm.
And then you also have this thing called TPO, and it's found in your liver. So those two
Okay.
combined, they work on creating your blood cells and all that stuff, right? Now your blood cell is created, right?
Yep.
We're talking about red blood cells still here at this point, and it's erythropoietin that we're talking about. So while this is occurring, cell is alive. Let's say you get a cut.
Mhm.
Boom, I get a cut on my hand. So from this not bleeding out to where I die, you have this thing called coagulation that occurs, a coagulation cascade. So all that means is there's blood clotting.
Mm.
So how it occurs is that you have this thing called collagen. Like you take collagen
Yep.
peptides, so right?
Yeah.
So you have collagen that gets exposed.
Mhm.
That exposing of collagen then sends a signal down that says, "Oh shoot, I'm getting exposed. We need to cover this up."
Mhm.
So for it to cover up, now you're sending recruitment, and all like these red blood cells are found and all this stuff. Cool, whatever. Now you have this thing called It's called thrombotin or thrombin, something like that, right?
Okay.
So basically, all it does is that called it. Basically, all it does is that it grabs all the red blood cells and goes like this.
Okay.
And for this to occur, you need thrombotin or thrombotin, whatever it's called.
Yeah.
When this occurs, now you have blood clotting and all that stuff, and now it creates an interior and exterior scar or like scarring.
Yeah.
So
So
that's
that's
how
what a scab is.
that's what a scab is.
Okay.
Yeah. So and then for this to keep make sure that this doesn't keep going and then like and like not cause like pulmonary embolisms or like any type of like clots that get thrown inside of your bloodstream, you
Yeah.
have other things like anticoagulants.
Mm.
So like the number one anticoagulant everyone knows of is aspirin, like a
Yeah.
blood thinner, right?
Yeah.
So there's other ones that help with just the cascade effect and assuring that the cascade effect doesn't keep going,
Mm-hmm.
and it's called like heparin.
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 Oh, heparin.
Yeah,
Okay.
and heparin, and it's not even a medication. Your blood, your body makes it already.
Yeah.
But when you take that medication, it helps heparin get made faster or made more of
Okay.
if you don't have it.
Yeah.
So heparin, all it does is that it thins out the blood, which allows it to not have that coagulation effect occur anymore.
Okay.
And then you have one more thing called anticoagulant 3,
Yeah.
or it's antithrombotin 3.
Mm-hmm.
And then you also have one more thing called protein C. So these three combined make sure that the coagulation cascade doesn't keep going and that you don't clot excessively.
Yeah.
So then once again, you can always have issues with like stuff like that all the time.
Mm-hmm.
And that's how that works.
Yeah.
That's the main job of your red blood cells besides carrying oxygen to the muscles and all that stuff.
Yeah.
Now, we are at the death of the cell. So the death of the cell occurs in this organ called the spleen.
Spleen.
The spleen. Yeah.
Isn't that like in here somewhere?
Yeah, it's like right here ish.
Yeah.
Something like that, right? Like
Yeah,
have you heard
yeah.
of like if somebody gets punched in the spleen and like they have a ruptured spleen, it's like
Oh, yeah.
and like they have like they need to get emergency surgery.
Yeah.
The reason why is because you're gonna have an increase of this thing called or decrease of this thing called bilirubin.
Bilirubin.
Yeah.
Okay.
So we're at the death of the cell now. Okay. So what we talked about in the red blood cell, what is found inside that red blood cell?
Oxygen.
Yep. And where does oxygen bind to? Hemoglobin.
Oh, hemoglobin.
Right.
Yeah. Yeah.
So
Okay.
all right. So we're in the red blood cell,
Yeah.
right? And hemoglobin is found in. So now in that red blood cell, there's
Mhm.
hemoglobin, and hemoglobin has 4 oxygen binding sites. Cool.
Yeah.
So hemoglobin is very important because it has iron in it.
Yeah.
So this is why, like, for example, you need to take iron supplements or like you need to have iron in your diet, as in
Yeah.
like you eat red meats, right?
Right. Yeah.
It's important because of this factor is when you don't have that iron, you don't have that heme group. And if you don't have that heme group, you don't have the globin group. Now hemoglobin cannot be created and now you cannot have oxygen found in your tissues,
Mm.
right? So now we're on the spleen. Inside of the spleen, what occurs is apoptosis, basically cell death.
Mm.
So what happens is that there's this transport protein called transferrin, and transferrin grabs that heme group or in like that iron,
Mm-hmm.
grabs it from that blood cell because at this point the blood cell's dead,
Yeah.
so you can't really do anything with it. So it'll grab it and then throw it into the bloodstream,
Mm-hmm.
and then it'll go back to the kidney to help create using erythropoietin to create more red blood cells using that.
What the fuck?
Yeah.
This
Right?
thing just alley oops iron back to the kidney.
Literally, it's so cool. It transfers. So it grabs it and tosses it back in.
So then, where's the blood cell go? It transfers to the.
There you
spleen?
go. You see this? You see this? So the blood cell, right? Now, the only thing left of this blood cell is the globin group.
Okay.
And the globin is basically that whole like coagulation stuff that happens, right?
So the blood cell is dead, right? Meaning
Yes.
it can't serve its purpose as
Exactly.
far as like creating a scab and
Correct.
blood clotting and shit like that.
Yeah, and then like sending oxygen to certain areas, right?
So what changes in the cell itself to determine if it's dead or not?
Oh, yeah. So that basically the death of it is the age. Basically, literally like like how we age.
So it's just not like strong enough to do all that stuff.
Yeah,
Like,
because it becomes incompetent.
oh, okay.
So like I can get into a whole different thing about incompetence, like how it's huge inside of your body. Like if you heard of
Interesting.
incompetence, like how we think about incompetence
Yeah,
is
yeah.
erectile dysfunction, right?
Yeah.
Incompetence inside of the body is crazy. If one thing becomes incompetent, your body's just like, all right, let's kill this thing. Yeah.
Damn.
So like, have you heard of like the varicose veins or like spider veins or anything like
I've heard
that?
of spider veins.
Yeah. So where you have like the nasty like bulging
Little
like
patches of vein.
Yeah. So how that happens is incompetent venule valves.
Mm.
So if the valves don't open and close, they just cause blood pooling to occur and it becomes a thicker, nasty looking vein. And that's what happens.
Ooh.
Yeah. All right. Back to the story, right? So we're back in the spleen.
Yeah.
Okay. Transferrin already did its job. Alley-oop the iron back to erythropoietin found in the kidneys. So the globin group that's left, what happens is that now the spleen's job is using a different protein. I forgot the name of the protein, but it
Mhm.
uses a different protein
Yeah.
and it breaks it down. It lyses it. Boom.
Okay.
Splits it in half.
Yeah.
And it grabs that globin group and tosses it back into the bloodstream for the liver to use.
Okay.
And now the liver's like, all right, cool. Now we're gonna use the TPO. Boom. Now we created another blood cell.
Mm.
So the only thing left is like this big bulky looking like shell of a hemoglobin. Does that make sense?
Yeah.
So the iron group is gone, the globin group is gone. The
Mhm.
only thing that's left is like this like bulky looking hemoglobin
Okay.
with nothing available.
Yeah.
So then the spleen breaks it down to this thing called bilirubin. Now bilirubin is also found in the liver
Okay.
and it creates bile. Have you heard
Mhm.
of bile before? It's like this yellow thing.
Yeah, I've thrown it up before.
Yeah, right? So that's what that is.
Yeah.
So now that whole explanation I went through with how like that globin group.
Mhm.
So think of that globin group as that bilirubin that gets broken down into bilirubin. Make
Okay.
sense?
Yeah.
So now all the spleen does is it's like, yo, I already killed the cell.
Mhm.
Liver, take this.
Mhm.
Now the liver uses that to create bile to help break down food inside your body.
Right.
Right? If you have an excess and like a crazy amount of bilirubin, you're gonna have this thing called jaundice. So like yellowing of the eyes, yellowing of the skin. Like, have you seen Michael Jordan's eyes?
Yeah.
That's jaundice.
An excess of
Bilirubin
bilirubin.
found
Okay.
because of excess breakdown of the spleen through the liver, or the liver just becoming incompetent and just not working well
Mm.
because of smoking.
Mm. All them championships.
All them
Catching up.
championships, man.
Catching up.
But that's basically the whole life cycle of the cell and how the blood works through oxygen, like using oxygen transport.
Mhm.
I haven't even talked about the bicarbonate buffer or anything like that because it
Oh.
gets too complicated.
Yeah. So,
Yeah.
what is it? TPO?
TPO is found in the liver.
Hemoglobin.
Hemoglobin is found inside the cell. Yep.
Is that from the kidneys, right?
Kidney is erythropoietin, EPO.
Oh, okay. Where does hemoglobin come from?
Hemoglobin comes from um the iron.
Okay, yeah,
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 iron from your diet.
yeah. Yeah.
So now we're gonna now
So,
based off of that, right?
so then, all right. So let's look at a 4 month span of a red blood cell, right?
Yeah.
So this singular cell is literally going through every single part of your body
Mm-hmm.
for 4
Up
months.
and down. Yep. Up and down.
So where does it turn around at?
What do you
Like
mean?
if it goes to my tips of my fingers, where
Yeah.
does it go? It just turns around.
It turns around. Yeah.
Like what? How though? Just the
Oh.
shape of the vein,
Oh. Yeah.
just
So
circles back.
okay. Yeah. That's a good question.
Because I
So
know like I've seen like diagrams or like all human body, but in veins, and
it's like a whole thing,
it's a
right?
whole human body with just like red lines,
Yeah.
and it's like at the tips of your fingers, like where does it go? You
Yeah.
know?
Dude, that's a really good question. Okay. So
I don't even know.
no. So basically, how it works is like
Because
let's
what?
talk about.
Hold on, let me
Yeah.
clarify this.
Go ahead.
Right?
Go ahead.
Like veins go away from your heart, and
No. No.
arteries go to your heart, right?
No. No. Other way. Flip
Other
it.
way there. Oh,
Yeah.
okay, so veins put
Bring
blood to
blood
your
to your
heart.
heart. Yeah.
Okay.
And then arteries bring blood away from your heart.
Yeah. Okay.
Or
Okay.
away from your heart. Yeah. Okay.
Yeah.
So let's go back. Let's break that down now. That's smart. All right. So what do arteries do? We just talked about it.
Supply blood away from the heart,
Okay, cool.
opposite direction.
Right. So the arteries are found in the ventricles for the most part,
Okay.
in your heart.
Yeah.
Cool.
Yeah.
So the ventricle, it's the one that pushes blood away from the heart
Yeah.
into these arteries.
Mhm.
So now you're in the arteries, right? And you have two big arteries that are found.
Mhm.
So like big area that distributes into arteries, which is basically your aorta,
Mhm.
your aortic arch. So it's like this little
Yeah.
thing, right? So then you have three arteries that go up, or like there's like two big ones that go up, and it's your carotid.
Mhm.
And then you have one that's connecting to your heart.
Mhm.
So literally that supplies blood to your heart.
Yeah.
Then you have um everything else that goes into everywhere else.
Mm.
Cool. So we're in the aorta. Now we're inside of, let's say, this area,
Yeah.
your fingertips,
Yeah.
right? So the artery is your brachial artery, which
Mhm.
connects here,
Yeah.
right?
So
Now basically
bicep vein,
bicep artery.
or bicep artery.
Yeah, yeah. So we're in the artery, brachial
Okay.
artery.
Okay.
Cool. So now we're at this junction.
Yep.
It breaks into this thing called an arteriole.
Okay.
Cool.
Yeah.
So now this arteriole, actually no, we can keep going down because we're talking about the finger, right?
Yeah.
We can keep going down. Okay, brachial artery. Now we are at the finger, the fingertip that we were talking about, right?
Yeah.
Your middle finger.
Yeah.
It breaks into this thing called an arteriole.
Okay.
Cool?
Yeah.
Inside of this arteriole, after this occurs, it branches out like this.
Mm-hmm.
Cool? Now we're in one of the arterioles.
Mm-hmm.
In one of the arterioles, now we're breaking it down even more to a smaller thing, right?
Mm-hmm.
Where there's a thing called a capillary,
Okay.
right? This is
Heard
where
of
the
that.
blood exchange occurs, where we
Yeah.
were talking about,
Yeah.
right? So one side of the capillary is the arteriole.
Mm-hmm.
Okay? This is where the blood gets distributed
Okay.
throughout the body
Yeah.
using osmotic pressure, all that
Yeah.
stuff. That's a whole other spiel I can go on about. Osmotic pressure, hydrostatic pressure. If you have too much of this, then you're gonna have edema, and like if you don't have edema, all that stuff, right? So if you have only one side available and you're
Mm-hmm.
just distributing blood,
Yeah.
how is the blood gonna get back? It can't, right?
Yeah.
So there's a connector, venule, right?
Mm-hmm.
So the venule is what grabs that blood that you already distributed. Now it's on this side of my arm, right?
Mm-hmm.
In the venule, it goes back.
Interesting.
So in the capillary exchange
So is it going from like an artery
to
to
a
a
vein.
vein?
Yeah, that's how that works.
Damn, it's kind of lit.
Yeah. So it becomes a venule and then becomes a vein back.
So capillary and
Capillary.
venule.
Yes. No, no, no. It's arterial,
Arterial.
venule,
Get it.
and the connection
Artery,
between the two.
arterial, vein, venule.
Yeah. So
Okay.
the two connecting together is the capillary.
Mm.
Yeah.
So weird.
Yeah. So now your next question would probably be, how does blood even like get there? Like, why do you even need blood there, right?
Well, another question, right? So
Yeah,
like,
yeah.
so like, you cut your arm,
Mm-hmm.
you get a cut
Boom.
on your arm,
Yeah, yeah.
but you don't cut the vein, right?
Okay.
Like, how is there blood there? Is there? How does blood? Is there like you said before,
Mm-hmm.
valves that blood comes out of that
Yeah.
like goes over
Mm-hmm.
everything?
Yeah. So
Is that what
how
it is?
that's a good question. So basically, like for example, if I have like a superficial cut,
Yeah.
let's say like I get poked with a needle,
Yeah.
I'm not gonna have blood come out
Yeah.
just because I'm still in the skin.
Right.
But let's say I slit my wrist,
Yeah.
just like I end up like I was in the car or something like that, and I was like trying to grab something like a little knife
Yeah.
like thing would happen,
Yeah.
right?
Something sharp grabs
Yeah.
you.
So now my wrist is slit. Now I'm bleeding.
Yeah.
So for this to happen, all that happens is basically we're in the capillary,
Mm-hmm.
right? So this is where hydrostatic osmotic pressure comes into play.
Okay.
Cool. So if you have high hydrostatic pressure, then that means that the blood will be distributed into the interstitial fluid. Okay.
I don't know what
So okay. So basically we're here, right?
the fluid on the tissue.
Yes. That's what that
It's
is.
not just blood.
That's what the blood is.
Uh,
So the blood is interstitial. So the one that we find is interstitial.
so
The ones that
there-
we look at.
So like, take the muscle, right?
Mhm.
There's just blood that's just flowing like inside and out of it, and like
There's blood
on top.
everywhere, bro. Like everywhere. Like literally
Okay.
you can think of a place and it has blood there.
Okay, but
Yeah.
the veins and arteries just carry it to there, and then
Exactly.
there's openings in the arteries and veins that
Yes. And
splurge
this
out
is
and cover everything.
exactly. And this is when the gas exchange occurs that we talked about, where
Mm.
the hemoglobin's like, oh shoot, the pressure's way too low here. Let me drop an oxygen there.
Mm.
That's when this is occurring in the capillaries.
Mm. Interesting.
Yeah.
That's so weird. It's so much more complex than like in high school, dude.
Yeah, like in high school, this is literally what she said to us.
It's crazy.
The first day she talked about it. She's like, whatever you know about breathing, whatever you know about circulation, forget about it.
Yeah.
Because in circulation, when you hear is like, oh, arteries grab or like they're always oxygenated blood.
Yeah.
It carries oxygenated blood. That's not true.
Yeah.
The only reason why is because you have a pulmonary artery which carries deoxygenated blood, and then you have a pulmonary vein which that carries oxygenated blood. So it follows against that gradient.
Dude, what the heck? So there's like just no simple way to learn anything about the body.
Exactly. So that's why they break it down by saying that, oh, you breathe in oxygen, you breathe out carbon dioxide. Because like in theory it is true. If
But
you're
it's,
like trying to be
such a small amount.
yeah, and like in theory it is true, right? But like
Yeah.
it's so much more complicated than that because
Right.
you're not breathing the oxygen, you're breathing air.
Yeah. Oh,
Yeah.
interesting.
Yeah.
So then with like how you said earlier with like mucus trapping in like all the bad stuff
Yeah.
in the air.
Yeah.
So like what causes like mucus buildup?
Oh, like
Is
for
there-
example, like allergies or something like that.
Yeah, like
when you're
is there something in the air that you like pollen or something? Like is
Mhm.
that pollen that goes up into your mucus make it react to make it produce more?
oh, dude, you're thinking in the right direction, bro. You're thinking like a scientist here.
Okay.
So you are
Interesting.
right. You are right
Okay.
that basically pollen, or like for example something that you're allergic to, right? It
Yeah.
creates an allergic reaction,
Or dust, something like that.
dust or something like that, right?
Yeah.
So let's just talk about, let's say I'm allergic to pollen. There's this thing called histamine. You've heard of histamine,
Yeah.
I'm
Yeah.
assuming. Okay.
Antihistamine is a medication.
There you go.
Yeah.
Right? There you
Okay.
go. Okay.
Yeah. Yeah.
So let's say I'm allergic to pollen, right?
Okay.
Now my nose breathes in the pollen.
Yeah.
Now there's a receptor inside of your nose that's basically a how would I even say this? Like to make it very simple, it's a chemoreceptor. So it responds to chemicals,
Okay.
right? So that chemoreceptor then sends a response to your brain,
Mhm.
or it can send a response to your parasympathetic system, whatever, wherever that area is, but it's usually going to go to the brain.
Mm.
Okay. In the brain, you're like, oh shoot, this is a foreign object, and I've
Yeah.
never seen something like this before,
Mhm.
and I'm hypersensitive to it.
Mm.
So what ends up happening is that your brain goes into sympathetic mode to fight or flight to try to
Yeah.
save your life.
Right.
So then what it does is that it releases this hormone, or not hormone, it's like a neurotransmitter hormone type deal, right?
Yeah.
Called histamine.
Okay.
And what histamine does is that it pulls into your blood. Now you have like this hormone or like this little gas thing that's coming around,
Mhm.
histamine. What it does is that it causes certain reactions to occur, as
Mhm.
in bronchodilation, or sorry, bronchoconstriction, which means that you're,
Bronco, like in your lungs.
yes,
Okay, because I
yes,
remember I remember younger, I was getting like having
bron-
coughs.
bronchitis.
Yeah.
Yeah.
Okay.
Okay, so bronchoconstriction. When you hear the word constriction, what do you think of?
Like squeeze tight,
Squeeze tight.
restrict.
Yes. So your
Yeah.
lungs are squeezing, which
Yeah.
means it's harder for you to breathe,
Right.
right? And but it also does this thing. So it basically binds to it now histamine releases from your adrenal cortex or your adrenal medulla. And now inside your adrenal medulla as well, you have epinephrine,
Mhm.
which is basically the opposite of histamine,
Okay.
right? Your brain's releasing this thing called norepinephrine, NE, or noradrenaline, right?
Is that why there's EpiPens? So
Yes.
you okay?
Right?
Interesting.
See?
All right.
So now the question would be, why is it not the EpiPens? Why is it the EpiPen? So this is why.
The norepi.
Because there's norepinephrine and epinephrine. So there's
Oh,
two.
okay. Okay.
So norepinephrine, it gets released from the brain. It's a
Mhm.
neurotransmitter.
Mhm.
So inside of your brain, it gets released and it binds to this thing called the alpha beta-nergic the alpha adrenergic
Mhm.
receptor.
Okay.
And it's usually muscarinic, maybe nicotinic. It all depends, right?
Yeah.
Usually muscarinic, nicotinic. Okay, usually nicotinic, right?
Yeah.
So when it binds to this, it usually causes your arteries and like all of your blood vessels to constrict.
Oh, so epinephrine is to do the opposite, so it makes them bigger,
Yes,
better
relaxes
blood.
it. All
Oh,
right.
okay. Okay.
So epinephrine. So now basically now your whole allergic response is occurring.
Yeah.
Cool. So now the question is, why does your nose run?
Yeah.
Right? Why does this occur?
Mm.
It's because you have this thing up here is your tear duct,
Right.
right? Your lacrimal duct.
Yeah.
And when your lacrimal duct gets activated, it causes your tears to be
Mhm.
created. And then like this little like pink area right here on your eye,
Yeah. Yeah. Yeah.
it's a duct that connects your nose and your eyes together.
Okay.
So that tear can go down into your nose,
That duct.
that duct. Now
Yeah.
you have a lot more liquid found in your nose,
Yeah.
which causes your nose to run. So it's not
Mm.
mucus. It is mucus that's coming out,
But
but it's
it's a
also,
mixture with the tears.
yeah,
Oh, so you're crying out of your nose.
yeah. So do you like how, for example, when you're crying, isn't that crazy? It's like, for example, if you're crying, right? Don't you notice how you sniffle a little bit
Yeah.
while you're
Yeah.
crying?
Yeah.
That's because that's why.
Oh.
Yeah.
So it's not only coming out of my eyes; it's coming out of my nose, and it's.
It's because of your eye that this is happening. Because the
Oh.
lacrimal duct.
So it's not like creating more mucus; it's just
Mm-mm.
mixing with the mucus to
Yeah.
make it.
Run, yes. And then when your nose is clogged,
Yeah.
it's because mucus is being secreted so much to fight against that pollen.
Mm.
That's why.
So then it's even more liquid or liquefied
Yeah.
mucus
Exactly.
from the
So like,
tears.
yeah, exactly. So if you have no tears,
Yeah.
right, and you just have excess mucus,
Yeah.
that's just because it's fighting off the infection, or not infection, but like the pollen or like whatever
Right.
you're
Right.
allergic
Right.
to, right?
Right.
But if you are like, for example, like you're crying or like you notice like your eyes are watering and stuff like that,
Yeah.
that's what causes your nose to run.
Oh.
So let's say that the allergic reaction doesn't even include your eyes like your eyes to tear up or anything,
Yeah.
then you're just gonna have a huge clogging in your nose and you're not gonna have any drainage.
Mm.
That's how that works.
Interesting.
And then epinephrine, so like for example, EpiPen, right?
Crazy.
I shoot EpiPen in my thigh. Cool.
Yeah.
Epinephrine then gets released into my bloodstream,
Yeah.
and it binds to, instead of the alpha adrenergic receptor, it binds to the beta adrenergic receptor, also nicotinic.
Okay.
Cool.
Yeah.
So when this occurs, now this allows your when the beta binds, it does the opposite of norepinephrine. So
Mhm.
basically, for example, if my blood vessels are constricted because I'm in fight or flight, it's gonna dilate them now. I have bronchoconstriction, it's gonna cause bronchodilation.
Yeah.
All this stuff to happen.
Interesting. So
Yeah.
then, like, say you wake up like in the morning, right?
Mhm.
Your eyes are just like super like
Crusty.
irritated, crusty, like
Yeah.
super. You can't open them or anything
Mhm.
from pollen or whatever.
Yeah.
Like, why does that happen now?
Like for example, like I had an allergic reaction yesterday, and like when I woke up this morning, I couldn't open this eye because of like
Crusties on your eyelashes?
exactly right.
I haven't had that in so many years.
So when that happens, that's basically mucus buildup, or
So is that the tear duct like it's coming out of your eye while you're sleeping and it's
so
just drying up?
it's kind of weird. So anytime you cry or anytime that lacrimal duct is working 24/7 to lubricate your eye.
So this thing actually has a purpose.
Yes, that's the nasal lacrimal duct.
Like there's a little pink thing here.
Yeah,
Dude, like
that's
my
the
whole life
purpose.
it's been told that it has no serves no purpose.
That's the purpose of it.
Oh, okay.
Yeah, so you basically we're back to the tear duct, the lacrimal duct, right?
Yeah, yeah,
This is called the nasal lacrimal duct or
yeah.
space, right?
Yeah.
So in the lacrimal duct, it's always secreting liquid to
Mm-hmm.
make sure your eyes never dry up,
Mm,
right? So when you have a patient that has dry eye or like you see somebody that like they're always like tearing up on one side of their eye,
yeah.
it's because your eye there's a receptor that's like, oh shoot, my eye is dry, so I need to secrete more tears through the lacrimal duct and all stuff like that, right?
Yeah.
So it's always secreting liquid.
Yeah.
Now, when you have more, like for example, the lacrimal duct, if you have more come out like the tears, for example, right? You're just secreting so much of that liquid that causes your eyes to run,
Uh,
and then that liquid can also fall through that little hole into your nose. That's how that works. So for the eye crusties to occur is basically through a mix of that, where you're just having a lot of that buildup,
yeah.
and then it's basically like falling onto your
Yeah, it falls onto your eyelashes
eyelashes,
and then
yeah,
it dries up.
and it dries up, and it's a mix of that and then like oil and mucus buildup found in your like sebum here,
Mm,
yeah, because every single part that has hair on it, like keratin, will have a sebaceous gland, oil gland. So like for example, when your hair,
yeah.
yeah, it gets oily if you don't shower, right?
Right.
Same
Yeah.
thing here. You can have oil build up here. That's what causes that.
Damn, that's crazy.
Yeah, bro.
So allergies aren't what they tell you it is.
No, allergies is basically a histamine reaction. It's a reaction that secretes histamine. That's all that is.
Mm.
And you can take antihistamines or you can just take an EpiPen. It all depends on how serious the allergic reaction is.
So you can have like, so you're just crying out of your nose,
Basically, literally, that's how the best way to describe it is you're crying out of your nose.
and that's. I don't know. I don't. I'm gonna be thinking about this all night now.
Now, now think about it. Like for example, if somebody that you know starts crying and they start sniffing, you're like, oh shoot, that's the lacrimal duct and the nasal
Yeah.
lacrimal duct
I'm gonna get
connected.
all scientific on them, bro.
Yeah, like that's
I'm gonna
literally
be, I'm
how
gonna
I
get
feel
the
with
red. Hey,
physio.
did you know actually?
That's what I'm saying. Is like as soon as I took this class and like I started taking this class,
Yeah.
everything now starts making sense. Like when you start eating, I know exactly what's going on inside your body. So every time you eat something, I'm like, oh shoot, this is what's going on.
Yeah. Please don't describe that stuff to me ever.
It's not even nasty. It's not nasty. It's pretty cool though.
I'm just gonna try to enjoy my burger, and you're like, did you actually know you're
You're like, oh, hold on, the carbohydrates are getting breaking. You're getting breaking down by your tongue. Yeah,
That's weird. So then, okay, so you have oil here then because of your eyelashes,
yeah,
and that's mixing with the tears, and that's what's drying up on your eyelashes.
yeah. It's because you're not opening your eye when you're sleeping,
Yeah.
obviously.
Right.
So when your eyes are closed, it's gonna allow basically the connection between the two to occur.
Yeah. Interesting.
Yeah. So now, let's see how much you've retained. Okay.
Honestly, the biggest thing I've retained is the allergy thing because
Yeah.
that's like,
Because that was a question that you had, right?
and that was also like, I don't know, I have allergies, so it's like,
Yeah. Okay. Patient comes in, right? 15-year-old patient, woman. She is showing signs of an allergic reaction. Okay. You find out that she has no prior history of allergic reactions causing her to come to the
mhm.
ER, right?
Yep.
You run an allergy check. You find out that she's allergic to cats.
Okay.
Cool.
Yeah.
You notice that she's not breathing hard.
Yeah.
She's breathing fine. She's not
Mhm.
having syncope, which means she's awake,
Yeah.
right? What is your next mode of treatment?
EpiPen.
No, no, no. EpiPen is like last case
Yeah.
scenario.
Last. Yeah.
Yeah.
Okay. Yeah.
You would
Um.
prescribe
That's like if they're about to die.
exactly. What would you prescribe?
Yeah. Um.
You can either prescribe a medication or you can just do it through IV drip. To give you that's a hint.
IV drip. I don't know.
Let's break it down. Let's break it down. Okay.
Alright.
What
What are the other symptoms? Like if she's allergic to cats,
she's allergic to cats, so now
but
she's
she's fine.
sniffing. So she's sniffing. Her eyes are red. Her eye like, she's crying a lot just because there's so much water in her eyes. She just woke up from a nap, so you see eye crusties.
Oh,
Okay. You check her heart rate and her pulse,
they're normal.
normal.
Okay.
But you do notice that there's an increased elevation in her blood pressure.
Mm,
Cool. All that tells you is that your sympathetic nervous system is getting activated,
okay.
which means norepinephrine is out, and also another neurotransmitter hormone that came out. What was that one we talked about? Starts with an H.
High
Histamine. There
histamine.
you go.
Yeah.
Okay, so now she has histamine in the blood.
Yeah.
How do you counteract histamine?
Antihistamine.
There you go. So you prescribe an antihistamine.
So what is a real life medication that is a antihistamine?
Zyrtec,
Zyrtec, Claritin,
Claritin.
all those.
Yeah,
All those like generic like allergy med. Okay.
yeah, that's an antihistamine.
Okay. And histamine, real quick, run it by me.
hmm
What does that do? Like what?
Histamine basically is the cause of allergic reaction to occur.
Oh, okay.
It's a neurotransmitter hormone,
So it's the
whatever you want to
reason
call
why
it,
all those symptoms occur in the first place.
due to histamine. Yeah,
So that's
because
like
it activates your
antihistamine.
yeah,
Interesting.
because
Okay.
histamine activates your sympathetic nervous system, which allows norepinephrine to activate. That's why I said blood pressure increased, but our heart rate didn't increase.
Mm,
So that means that norepinephrine was bound, which causes vasoconstriction.
okay.
Yeah,
Damn, that's crazy, dude.
yeah,
That's so crazy.
yeah,
Now I understand how allergies work.
yeah. Isn't that crazy?
Dude, what the heck?
Now think about it like this.
Thank God you're taking this class for me.
Yeah, and like now we we can do this every week now because I actually love like talking about this stuff. I can talk about this for hours,
We're about to turn into like Bill Nye.
literally.
That's crazy.
Yeah.
Hmm.
Any more questions based off of that, like the stuff we learned today?
See, I'm just more interested in the allergies thing. 'Cause
Yeah,
I've had obviously like real life personal experience with
yeah.
it. Blood is just like whatever,
Blood
man.
is whatever. Everyone has blood.
Yeah, like
Not everyone has
I'm here
allergies.
today to learn about blood, but
Yeah.
um, hmm.
What other question you have about allergies?
So allergies, right? Okay. So I'm allergic to pollen,
Okay.
and somebody's allergic. Okay.
Okay.
Peanuts, right? Another very common like
Very common
allergy.
allergy. Yes.
So what's the difference between like a pollen allergic reaction and
Mhm.
a peanut allergic reaction?
Okay. Pollen allergic reaction. It's a very simple answer. Let's see if you can answer it without me answering it. Pollen allergic reaction. Okay.
Is that a dietary thing?
No, not
Like with
really.
your guts?
No, not really.
No?
It's basically off of your histamine. But my question to you is, with a pollen allergic reaction, do you have an issue breathing through your mouth?
Yeah.
Like,
Not through your mouth.
okay. When
Oh,
you have a
so
peanut
it's
allergic reaction,
you have a issue breathing through your mouth.
yeah, right? Or you just have issues breathing, right?
Yeah.
So now that becomes a life or death scenario,
Yeah.
which is why you need to take an EpiPen.
So peanut allergies are more serious than
Yeah, it's more severe.
okay. So what if you just have like a peanut allergy or allergic reaction? Can't just breathe through your nose and just like
No, because think about it. Your nose and your mouth, they're all connected
right
here
connects at the end and then it like goes down to one tube.
into one tube, your trachea, right?
Does that close up when
That
you
your
have
trachea closes up.
okay.
So that's what's called bronchoconstriction.
Okay.
So if you have bronchoconstriction, that means your airway is like literally like this, which means literally nothing's going through.
Constriction?
Yeah.
Okay. Interesting. So then what about like pet allergies?
Pet
Cats or
allergies,
dogs? Like is that same as pollen?
same thing as pollen. It's the same reaction.
Okay. And then what about like say you pet a dog, right? And you touch it, but then your hands and arms get all itchy? What
Oh,
is
you
it?
get hives? That's a histamine reaction.
Okay.
So every
So
every
that's just
allergic
like
reaction,
okay.
every allergic reaction that occurs is because of histamine,
Yeah.
right? It all depends now at this point. It all depends on how histamine reacts and how your body reacts to the histamine. So certain people can be hypersensitive, some people can be hyposensitive,
Mhm.
some people can just have different reactions, right?
Mhm.
So, like for example, what you're talking about is hives.
Yeah.
So when people break out in hives or like they get like start scratching or whatever, that's
Mhm.
because of the histamine reaction occurring somewhere that they don't know.
Mm.
Yeah,
So it's like on your skin rather than like all in
in
your
your face.
sinuses.
Yeah, exactly. And that is a different type of response, right? So
Mhm.
for example, let's say I'm allergic to cats, right?
Yeah.
I'm not allergic when I pet the cats because I don't have a reaction,
Yeah.
which means I'm allergic to their saliva. I'm not
Right.
allergic to their fur.
Yeah.
So for certain people, when they get like allergic reactions, that means that they're allergic to both the fur and the saliva.
Oh,
But
okay.
usually, for the most part, it's their saliva as well.
Yeah.
But it's because of like enzymes and all that stuff found in your skin and all that.
So if they say like a cat licks you on your hand, could you get hives from that then?
Can I get hives? Yeah. No, I can't, but certain people can. Yeah. It's just a different type of reaction.
So, but so even if you're allergic to the saliva and they
hmm
like get saliva on your hand, you still
hmm
can't get hives.
I can't because I'm just not hypersensitive.
Okay.
So there's certain people that are hypersensitive
Okay.
to the
Okay.
histamine.
Okay.
Does that
Okay.
make sense?
Yeah.
So like how histamine
Yeah.
gets released is because of an intruder, and the intruder in this case is the cat saliva.
Yeah.
So everyone's born with a certain type of allergy, or like
Yeah.
somebody's born with a certain type of allergy. For you, it's pollen. For me, it's pollen as well.
Yeah.
And anytime it sees pollen, it sees it as like an invader
Yeah.
instead of seeing it as like a regular thing.
Yeah.
We have certain thing that's messed up in our body that causes like a
Mm,
mutation that occurred that
yeah.
makes us think that, oh shoot, this is an invader. We have to attack it.
So it's like an imperfection in the brain that makes it react to that certain thing.
Yeah. I wouldn't even say the brain is just the body.
Or yeah,
Just the whole
body.
body, yeah.
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 Dude, now I know how allergies work.
Yeah.
Dude, that's so
So now if
crazy.
anyone has a question about allergies, I can
Dude, I'm
just
about to
send them to you.
school the shit out of them,
Yeah,
dude.
bro.
I'm gonna be like, did you know you're actually just crying out of your nose?
Yeah. You could be like, what do you mean crying out of your nose?
Dude, it's not mucus.
Yeah.
Because what my mom always taught me was
Yeah.
that when I cried, it was like mucus just coming out because you have an
Mhm.
excess mucus.
Yeah. Which she's not wrong.
Is
It's
it
just
excess mucus?
it's a mix of mucus through your eye.
Yeah, like say like I start like tearing up
Yeah.
because of allergic reaction to
hmm
pollen. Like
Yeah.
my mom would say it's boogers coming out.
It's a mix because that's
Okay.
how the
Well,
eye
what's
crusties
like the
happen.
ratio? What's the percentage of like tear to booger?
Tear to booger. Oh, it's like 80% tear, 20% booger.
Oh, okay.
Yeah.
Okay.
If it was higher, the booger.
So she's 20% right,
Yeah.
meaning she failed. So
Think about it like this, right? If it was flipped and it was 80% booger, 20% tear,
yeah,
you wouldn't even be able to open your eye when you blink because it's so like
so thick
when you
and it
pick your nose,
would be
right?
like a glue.
When you feel like the mucus in your nose,
Yeah.
and like for example, like it's thick.
Yeah.
That's how you know. Like now imagine that just in your eye.
Yeah.
That's how that.
Oh,
You see what I'm saying?
that's nasty.
Yeah.
That's nasty.
So that's how that works.
Dude, oh my god, my mind's pretty blown right now.
Yeah.
I'm still kind of lost on the whole blood thing.
Oh, I would be too. I would be too. Cause blood, bro. Do you know? Man, I wish I could show you my notes, bro. I showed you my notes in one of my classes, in that same class, on a different exam. It was 40 pages. This stuff I still don't get, and I have an exam Monday about
You're cooked.
it.
Yeah.
But
Dude, allergies. I'm gonna be thinking about that all night. That's
yeah,
insane.
it's pretty cool.
So histamine,
This is what really made me go into medicine, bro.
antihistamine. So the epinephrine is what again?
It's basically your last resort,
Okay.
like an EpiPen, or like just epinephrine in
Well,
general.
like epinephrine and then norepinephrine. Like
What's the
clarify that.
difference? Okay, so norepinephrine is your sympathetic response.
Okay.
So basically, it does everything that you will notice, like increased heart rate, increased blood pressure,
Mhm.
vasal or your pupils will constrict.
Mhm.
Um, basically everything that you'll see in fight or flight. Your digestion slows down,
Yeah.
stuff like that, right? And that binds to your alpha adrenergic receptor,
And then epinephrine does.
the opposite.
Okay.
So it's the response to norepinephrine.
Mhm.
So what epinephrine will do, this all depends on the receptor it binds to. This is what I have to say to clarify. If the epinephrine binds to the alpha receptor,
Mhm.
it's gonna have the same response as norepinephrine and it's just gonna maintain it going, right?
Mhm.
If it binds to the beta receptor, then that's when the opposite will occur. So epinephrine as the hormone will not be the counter of norepinephrine,
Mhm.
but if it binds to the opposite, as in the beta adrenergic receptor, then it will do the opposite.
Okay.
Yeah. Because epinephrine can also maintain your fight or flight response. It all
Mhm.
depends on where it binds.
Gotcha.
Yeah.
So when somebody does an EpiPen, that means that the epinephrine binded to the alpha, and it kind of kept that norepinephrine response happening.
Yes,
So that people
if
have to
you're
take the
yeah,
EpiPen because of that.
exactly. Or like your epi,
Mm,
or like for example, your epinephrine's not working fast enough, because
okay.
an epinephrine response takes a long time. It's
Okay.
a longer response time.
Yeah. Interesting.
Yeah, norepinephrine will always be faster than epinephrine because norepinephrine is a precursor to epinephrine.
And that's like a more serious thing with like peanut allergies kind of thing.
Yeah,
Can that happen with pollen if it's bad enough? Like, could it
it's a good
ever
question.
like?
Yeah, I mean, it can. I mean, I haven't seen a case like that,
Yeah.
but it can happen.
Hmm. That's so.
Because think about it, it's the same response. It all just depends at this point how your body reacts to it. This is where the hypersensitivity comes into play.
Mm,
So the strength of your response, as in like how strong your body responds to it, as in like how bad you're gonna die type
yeah.
deal,
Yeah.
that's how you know if your body's sensitive or not. So in
So
every
crazy.
so like every single person, me, you, your dad, your mom, my dad,
Yeah.
all of us have the same allergic response.
Mhm.
We all have the same allergic response.
Mhm.
We all do. But the difference between our responses is off of the sensitivity found in our body.
Okay. So like you can react to a smaller dose of pollen quicker than
You would.
like I can need a larger amount of pollen to react before you do.
Exactly. And that's based off of sensitivity.
Mm. Feels so weird knowing that.
Yeah.
Feels illegal.
Feels illegal. Yeah. We learned a lot about like the medical system and like how it's so messed up.
Is it?
Dude.
Well, yeah, one cured patient is a lost customer, you know?
Yeah, exactly. So that's why they keep sending you, and also they make money by prescribing you medicines.
Now let me ask you
Yeah,
this.
yeah.
And you better start sharing me some secrets about
Sure.
this. So, do you think that when they make a medication, we could even say the COVID vaccine.
Okay.
I don't care. Sensitive topic or not, I don't care.
Right.
It's a fucking vaccine. Who
Yeah, yeah.
gives a
It's a
shit?
vaccine. Right.
And so you think when they were making that vaccine
Mm-hmm.
that they purposely either didn't put something in it or they put something in it to make it maybe not work over time
Mm.
and for people to need that booster
Mm.
so that they would make more money? Like
Good question.
do you think they think about that when they're making a medication, whether it's just a simple anti what is it,
Histamine.
histamine
Yeah.
medication for allergies,
Right.
or if it's just Advil, Tylenol, whatever,
Mm-hmm.
or as you know, like even chemo. Do you think
Great
when
question.
do you think when they're like making those medications and
Mm-hmm.
treatments, like in the back of their head, they're like, okay, well, we should add this because it'll make it wear out a little bit more, so they have to keep taking the treatment,
Yeah.
or are they like, do you think they're thinking of like, okay, well, we need to make money on this medication, but if we just make it how it's supposed to be to cure somebody,
Mm-hmm.
then they're never going to need this again, and we won't make
Yeah.
any more money on this medication.
Okay. So short answer is I don't know, and yes and no at the same time.
Okay.
But there's a really long response to this.
Okay.
So basically, let's break it down to how a drug is created. Okay?
Mm-hmm.
There's a problem, we need to fix the problem,
Right.
right? So how it works is like, for example, if let's talk about the COVID vaccine later because
Mm-hmm.
it's a completely different process.
Okay. Okay.
But let's talk about the polio vaccine for a minute, right?
Okay.
So in the polio vaccine, how it works is that it is an inactive type of, so anytime you have a vaccine, it's to a virus,
Right.
flu, rhino,
Mm-hmm.
any type of virus, right?
Mm-hmm.
So what you do is that you get the inactivated version of the virus. So let's break it down a little bit more so people can understand.
Yeah.
Okay, you have bacteria and then you have virus.
Right.
Bacteria can live without any type of host.
Yeah.
A virus is inactive unless it has a host, which will activate it.
Okay.
Virus is not living.
Right.
Viruses don't live.
Yeah.
Bacteria live. They're
Mm-hmm.
living things,
Yeah.
right? So with a virus, if you don't have something in vivo, as in meaning like inside of your body,
Mm-hmm.
it's gonna be inactive in vitro, which means in labs or in petri dishes, but
Yeah.
just because
Yeah.
it doesn't have a host.
Yeah.
So they'll put a small dead polio virus inside of the vaccine
Mm-hmm.
to then put inside, and then that's essentially what a vaccine is,
Yeah. Yeah.
right?
Yeah.
It's an inactivated virus so that your body can code for it.
Yeah.
So that's how a vaccine works: is that your body will code for it, and now it
Mm-hmm.
has a immune response, knowing of, oh shoot, we've seen this before. This is how will respond to it. Now you won't die, or like you won't have paralysis or you won't have like these issues that people had with polio,
Yeah.
right?
Right.
Usually this takes minimally 15 years to occur, right?
Mm.
To develop a vaccine, to develop a drug, maybe takes 10 years. Fastest, absolute fastest, because there's different phases.
15 years to come up with a vaccine to fight a virus.
Yeah.
So,
It takes usually $3 billion to make it on
holy
average.
shit.
On average. Yeah.
Oh.
Yeah.
So, I know you said we're talking about COVID vaccine.
Yeah. Yeah.
So, do you think it was kind of sketch with that, how soon they came out with
Yes.
the COVID?
Yes. So this is why.
Okay.
This is why. Okay.
Okay.
Based off the knowledge you know now, where
Yeah.
not just vaccines, but drugs in general, like Tylenol, all the
Yeah.
way up to like codeine, right?
Hmm.
It takes almost like 10, 15 years to make,
Yeah.
12 years,
Yeah.
right? We got the COVID vaccine in a year,
Yeah.
right? The reason why is because the FDA, the Federal
Mhm.
Drug Administration, they are responsible for the approval and then like the patents that come out,
Yeah. Yeah. Yeah.
right?
They got to verify
They got to
shit.
verify
Yeah.
and all that stuff, right? So there's certain things that they bypassed, the FDA bypassed, right?
Hmm.
Would I say it's logical or not logical? What is it? Would I say it's moral? It all depends on what happened, right? We're in a
Yeah.
pandemic, so obviously you're gonna bypass certain things,
Yeah.
certain like cautionary things that you have to do, right?
Yeah.
So that's what they ended up doing because we're in a global pandemic. Something has to come out of it.
Right.
So when a global pandemic occurs, the FDA has rights to change certain parts of the clinical trials,
Yeah.
and there's 4 stages. So they can like, for example, one like stage 3, which is like you distribute a small like patient like small amount of patients
Hmm.
with the drug or like with the vaccine to see what type of response they have. This usually takes about 3 to 5 years. Phase 3 can take 3 months.
Mm.
And also think about it like this is like there's certain people, like for example, I can be working on a different drug, your dad can be working on a different drug, you can be working on a different drug, right?
Yeah.
It's gonna take a longer time, obviously, because we're working on different drugs.
Right.
But now all of us put our brains together to work on one thing
Now it comes out even quicker.
faster.
Okay.
Because now people are researching 24/7 and all these
So,
researchers are
are
working
you saying
24/7.
that 10 to 15 year range is from one person working on a drug?
A team working on a drug.
A team?
But
Okay.
like for example, I'm a different team than you're a
Yeah.
different team, right?
Yeah.
So that's how that works. That's how a development of a drug works, right?
Hmm.
Now, where the part I would say yes to where it's a money grab is that it's $3 billion that you have to pay
Yeah.
to get this. I think that the COVID drug, the vaccine was even more expensive
Yeah.
because it was expedited to the
Yeah.
point where it literally dropped from 10 12 years to be created to almost like less than a year.
Yeah.
Obviously, it's gonna be a lot more expensive. I'm thinking like in the $7 billion range, right?
Damn.
So, I mean, this is not the job of the scientists to think about because the scientists are getting paid regardless. They're getting
Right.
paid to find the cure.
Right.
This is where the Pfizer, the big pharma companies come into
Moderna
play,
and all that
Moderna,
shit.
and all these like Tylenol, Bayer, all of like
Okay.
these like big pharma companies that you think of.
Yeah.
That's their job to think about
Okay.
because now they're
So
trying to break
scientists
even at
don't
least.
think about it themselves. They're not like
That's not their job.
they're just like, all right,
They're
we'll
getting
get
paid regardless.
yeah.
So that's why I hate when people try to put the blame on the scientists
Okay.
and be like, "Oh, this is the scientist's fault."
See,
They're
I didn't think about
right.
that.
Yeah.
Okay. Now I know.
So like for example, like when when I'm synthesizing a drug, I'm trying to figure out the to
Yeah.
solve this problem, right? It's not my job to figure out the side effects. It's not my job to figure out if I'm going to kill somebody.
Yeah.
My job, if like for example, if I'm an organic chemist or like a medicinal chemist,
Yeah.
my job is to figure out if I can even fix this.
Yeah.
If this is even possible
If
to
you
be
can
fixed.
kill the thing,
If I can kill
that's
the thing.
yeah.
My job is complete if I can, right?
Okay.
Then you have another group of teams, which are the researchers. Their job is to find out how much of the dose to give, how toxic is it, how inhibitory is it.
Hmm.
So like toxicity, all that stuff, right?
Yeah.
Oh, camera died.
Oh, that's great.
All right, pause it.
Yeah. All right. I have no idea what just happened. Camera died. I don't know. We just literally hit a pause button, so
Yeah, we're back.
yeah, no clue if how that's gonna look on the video.
Yeah.
So
Anyways, back to what we were talking about.
yeah.
So with like these big pharma companies that are like the scientists, right? The researchers,
Yeah.
it's their job to figure out if it's toxic or not. And
Okay.
like this is where stage phase 1 occurs. Phase 1 is giving it to realistically college students because they're getting paid to do it. Healthy college students because that's the area or there's that or the people that are terminally ill and they're just
Mhm.
willing to take something.
Yeah.
If that makes sense,
Kind
right?
of being the guinea pigs for it.
Exactly, because they're like, I'm gonna die anyways. Might as well try it to see if this will fix me,
Yeah.
right? So those are the two people that are found in phase one,
Okay.
and it's a small number of people that
Yeah.
have this, right?
Right.
Phase two is the same thing, same types of testing, but in a bigger group of people in a wider demographic. So instead of finding college students, healthy male college students for the most part, now you're gonna find healthy female college students or like healthy male and female like demographic from like 18 to 30,
Mhm.
right? Phase three is when you start giving it to people that actually have like the issue.
Yeah.
It all depends on the issue, right? But like in a smaller dose.
Mhm.
Phase four, phase four is when it becomes like widely distributed.
Mhm.
Phase five is when it's distributed, but there's research more and more occurring because every drug has a side effect,
Right.
and you're just basically doing more research to find what type of side effects are occurring, if
Mhm.
there's any new side effects,
Yeah.
what is like the rare occurrences that happen, stuff like that.
Mhm.
That's the researcher's job. It's just to see if there's any type of side effects that occur.
Okay.
Does that make sense?
Yeah.
Then the big pharma companies, their job is to make money, and how they make money is crazy. So Bayer, for example, let's just talk about Bayer, just because everyone knows it. Aspirin,
Yeah.
right? Let's say aspirin got synthesized in 1890.
Mhm.
Cool. Phase five occurred in 1895. Let's
Mhm.
just say these are random numbers, right?
Random.
In
Yeah.
1895, right?
Yeah.
Now a patent has been approved. Now Bayer has 30 years where nobody else can create this product. Only Bayer can sell it and make this product. Otherwise, they can sue.
Mhm.
So within that 30-year time span, that's that's basically their insurance of making that $3 billion back. So
Mhm.
after those 30 years occur, now anybody can make this drug. Now generics end up making it.
Yeah.
So like for like these drugs that are older, like Tylenol or like acetaminophen, ibuprofen, all these, this is where you can take the generic version, the cheaper version, and get the same response, like literally the same exact response as the name brand. So that's why like instead of getting Bayer, you can always just get regular ibuprofen, like
Yeah.
Walgreens version of ibuprofen,
Yeah.
or like Tylenol. You can just get regular version of acetaminophen.
Interesting.
But they don't tell you this stuff because they
So
want you to
then,
get more
okay,
money.
okay, okay.
Yeah,
So right, you got scientists and then researchers,
then big
side
pharma.
effects, toxicity, cure, blah blah blah, all
Right.
this, right?
Yeah,
So they're all just getting paid. They're just doing their job.
they're just doing their job.
So then how? So where does big pharma then get this bad rap of like
Causing
causing bad things to
is
happen?
because they're scientists that work for big pharma.
And there's
And
scientists that you think that know secrets about big pharma and what they want in order to make more money.
yes, not like they're like changing the formula or like they're adding certain things to it. But I will say that they probably will like endorse that something that's not in it to make it more marketable to certain people, if that makes sense. So let's talk about the most common thing that everyone wants to talk about right now, Ozempic.
Yeah.
It's a GLP-1 injection, which basically all it does is that it binds to the GLP, which makes your appetite from your ghrelin, which is like a hormone, your hunger hormone.
Mhm.
You're not going to secrete ghrelin as much, which means you're going to feel a lot less hungry,
Yeah.
stomach shrink, stuff like that. Cool, right? So what certain scientists will say, like for example, Ozempic, right? They will say that, oh, it is a weight loss drug.
Mm,
It is not a weight loss drug.
right.
GLP-1 injections, they're not weight loss drugs. GLP-1 is for people that have diabetes, for people that have basically any type of hormonal issues when it comes to blood sugar levels, essentially.
Okay.
That's what GLP-1 is for.
Yeah.
But that's not how it's marketed. It's
Yeah.
marketed as a weight loss drug,
Yeah.
miracle weight loss. And then
Mm,
they will endorse certain celebrities to,
yeah.
for example, Oprah,
Yeah.
to sell it. That's how they make money. That's where it becomes messed up.
Okay.
That's where they get this bad rap. But for people saying that, oh, these big companies are adding stuff to it, that's not true. From what I
So
know.
okay.
From what
So
I know.
okay. So you don't think the scientists are like actually putting something or taking stuff out of the drug to make it like?
Because I'm gonna put it like this, right? Let's say
Do you
let's
think
talk
they?
about Legos.
Do you think they could be putting something in it to like make it even more addictive? Do you think?
That can be a possibility, but I don't know.
Okay.
If that makes sense.
Okay. Just
So
trying to pick your brain on
yeah,
this.
yeah, no. I like these questions. So let's talk about, for example, you like to build stuff with Legos, right? We
Just a
have the
little.
Lego set. Cool.
Just a little bit.
Just a little bit, right? So let's say that a new one comes out
Okay.
Okay, you don't have the blueprint, so you have to build it yourself.
Okay.
Does that make sense?
Yep.
So your job is to build the car with no blueprint.
Okay.
You built the car. Cool.
Yep.
Now you display it.
Mhm.
Is your job complete?
No.
Yeah, your job is complete.
Oh,
You
okay.
right? Because you built
Oh,
it.
as far as the scientist for making medicine is.
Exactly. You
Oh,
just
okay.
built it. Now it's complete, right?
Okay.
Now you give me the car, and I'm like, oh, cool. Let me see if it breaks if I pull this. Let's see if it breaks if I like just throw it. Let's see how durable it is, right?
Mm,
That's my job as a researcher. Okay,
okay.
cool. Now I let Lego know. Oh, we built this. Me and Dylan built this.
Mhm.
Here you go. My job is now complete. You didn't know about this testing where I threw it at a wall or like I pulled it apart. You don't
Yeah.
know anything about that. All you did was that you built the car and your job is done.
Yeah.
Your job
You
is
got
complete.
paid. You're
Now
moving
you're
on to.
moving on to the next drug or like the next car to work on. Does
Okay.
that make sense? So
Okay.
you're a contractor.
Okay.
That's how that works for the
Okay.
researchers or
Okay.
for like the medicinal chemist.
Yeah.
Then you have the researchers
Mhm.
where the researchers know exactly what you did and how you synthesized it.
Yeah.
And now they pick it apart, do all that stuff, right? Now my job is complete. I give it to Lego. Now I'm not gonna know what Lego does with it. All I know is I did my job. Now I'm working on my next project,
Yeah.
and I'm throwing more things.
Yeah.
So that's where it gets confusing. And now Big Pharma has scientists that will do certain different tests and like they'll endorse it differently and all that stuff.
Okay.
Yeah, I'm still trying to figure out how Big Pharma like does all this stuff, but that's how, from my knowledge from my medicinal chemistry class, from my human physio class, all this stuff
Mhm.
is that scientists and the researchers, they just do their jobs. They're contractors, so they just do their jobs, get paid, call it a day.
So like big pharma is kind of like the big marketing company
They're the issue.
that I know that they're the
Yeah.
issue for sure,
Yeah, yeah.
but like but they're kind of like that marketing company to kind of target certain people that like example Ozempic with weight loss, like obviously
Yes.
it's not a miracle weight loss drug, but they advertise it that way to
Do you
make
know
sales.
do you know why you lose weight? It's a side effect from the drug.
What is the drug initially supposed to do?
It's basically for people that have blood glucose issues,
Oh, okay.
and like it's supposed to be a different type of, like, for example, like if you're a diabetic,
Mhm.
let's say type 2, which
Yeah.
means that you have um insulin resistance,
Mm.
which means that like you're allowing more blood in or more glucose into your blood and you're
Yeah.
not really grabbing it. Like insulin's job is to grab the glucose from the blood and put it into your muscle cells, right?
Okay.
Insulin just letting it through because it's just like, all right, cool. I've seen
Yeah.
this before. It's not
Yeah.
that much. So you're gonna start taking like insulin acting drugs. It's like
Okay.
metformin, um, anything that you can think of when it comes to like any word that has in at the end,
Mm.
basically. Those are the type of drugs you're taking, right?
Okay.
So obviously when you keep taking that over time, you're gonna get immune to it
Mhm.
or you're gonna develop a tolerance to it, right? So you have to find a different way to take that drug.
Yeah.
So that's what GLP was supposed to be for. But the side effect that occurred, what the researchers found, so basically after the medicinal chemist, you have
Yeah.
the researchers found that one of the side effects was that, oh, like certain patients were losing weight. And then they basically, they write all this down, they give it to Big Pharma, Ozempic.
Mhm.
Now they did their job. That they're like, okay, cool. It does do the job of lowering your insulin, like your blood glucose levels.
Yeah.
But here are some side effects. Some side effects include you're gonna lose weight, your appetite's gonna decrease, you're gonna have a lot less hunger, stuff like that. But he's like, but these are the side effects that we found when we gave Ozempic.
Okay.
So now Ozempic or GLP-1 injections.
Mhm.
Now Ozempic's like, oh shoot, we can market it like that.
Yeah.
We're gonna make a lot more money like that. So
Yeah.
you're gonna give it to diabetes patients, but you're also gonna give it to patients that want to lose weight.
Yeah.
That's how that worked. Yeah.
Interesting. So they're just kind of like the marketing business to make it
Yeah.
just sales marketing kind of company. Okay.
Basically, their job is to make them 3 billion back plus more
Yeah.
that they already spent.
Mm. Interesting.
Yeah.
So then when you're talking about how there's like scientists hired specifically to
hmm
that big pharma company, do you think they're kind of like in the talks with how you could sell it more?
Yeah, I wouldn't be surprised.
Okay.
Yeah.
Interesting how that works.
Yeah. Isn't that crazy?
Dude, I learned so. Oh my god, dude,
Yeah.
that's crazy.
Like this is what I'm saying. This is why I really enjoyed
Oh my god.
this type of like podcast.
Cry out of your nose, big pharma.
Yeah. So this is why like
So what makes
yeah,
you think about like the COVID vaccine being kind of sketch then?
because of the fact that
How soon it came
how
out?
soon it came out. Just because, like, think about it like this, right? If I'm sending you like this without a blueprint, right?
Mhm.
And I have like a team of like millions of people trying to figure this out.
Yeah.
It's gonna be really fast. I don't have an issue with that, right?
Yeah.
It's that the researchers, their job was so time constricted that they're like, oh, we're gonna have to surpass like obviously we're gonna know how healthy people are gonna feel about it. Obviously we're gonna
Yeah.
know we're just gonna go to the sick people. We're just gonna give it to the sick people. We're gonna figure out if they're having any type of response, right?
Hmm.
And obviously it's not gonna take as long with clinical testing because we're skipping phase 1, 2. We're moving on to
Mm.
phase 3, 4.
So okay.
So they
So it
basically
was
skipped
with
one and
the
two.
okay. So yeah, it was with giving the researchers less time to understand the entire vaccine,
Yeah, and understanding what type of side effects that can occur and what if it
even
can
long
have
term
adverse
too.
effects. Yeah, exactly. Because think about it. If the drug was synthesized and came out, or like the vaccine was synthesized and came out in 9 months,
Yeah.
then they probably only had a month to work with it.
Damn.
Yeah, realistically.
Damn.
So they only were able to probably find out like, oh, they didn't have any response in like two weeks, and then they're fine. That
Oh
was probably like
shit.
what they found out. That's why people are very skeptical about it.
Yeah. Yeah, see, at the time, what were we, 15,
Yeah,
16?
something like that.
So it was like, my mom's like, you're getting the fucking thing.
Yeah,
Not
yeah.
actually like that, but
Hmm.
she's like, oh, you're gonna get it. And I was just like young enough where
Hmm.
I was like, dude, I'm happy to be out of school right now.
Hmm.
I'm just trying to hop on the game.
Hmm.
So it's just like,
Yeah.
if you're gonna make me get this thing, cool. If you're not gonna make me get it, probably not gonna get it.
Yeah.
So cool.
Yeah.
But I got it.
Yeah. And then
So
now let me break down the second part of your question, the boosters, right?
yeah,
They didn't, I would say, think about it like this, right? There's a flu vaccine,
yeah,
right? But you still need to take a flu shot every year, right?
yeah,
I don't, but like you're
yeah.
supposed to,
I didn't.
right?
Yeah,
But the reason why is because that's a flu booster shot because there's different strands that can come out.
right.
Same thing with the COVID.
COVID.
Because
Okay.
COVID, you can have different
Yeah,
strands
that had
that come
different
out.
strains.
And that's what the booster is basically attacking different strands.
Okay. Damn, I gotta be thinking about that shit now.
Yeah.
Dude, that's crazy. So then,
If you want to take the vaccine or if you don't, that's a personal issue.
right.
And I'm not gonna I'm just giving you the facts, right?
Yeah, I don't give a shit what people do.
That's what I'm saying. It's like
I'm
I
just
don't
trying to
care.
educate myself
Right.
on how that process
If
works.
you're a vax, anti-vax, that's more of like a political debate, personal
Yeah,
debate, all that stuff. I'm
yeah,
here just based off the facts,
yeah.
and I'm just telling
Oh,
you exactly
same.
what I know. You know what
Yeah,
I'm saying?
yeah,
So if you want to vaccinate and don't want to vaccinate, that's your choice. And
right.
I mean, I'm
Yeah,
not gonna
yeah,
be like, yo, don't do that,
yeah,
and I'm gonna be like, yo, do that.
yeah.
Basically, I'm not gonna do all that, right?
Right.
It's based off of the knowledge that you know,
Yeah,
and you know your body better than I know your body,
yeah.
right? So
I
that's
think
how it
that's just
is,
important for everybody. Like, you should know the facts and whatever decision you decide to make, who cares?
right?
Just do it based off of the facts that are given to you.
Exactly.
Like, if all the facts are laid out, now just pick on what you decide to do based off of the facts. So that's what I'm trying to do. Because I
Yeah.
never knew how, like, because, dude, like, if you told 15-year-old me this, I'd
Hmm.
be like, hell no, I'm not getting that vaccine.
Yeah.
But, like,
Right.
I didn't know at the time. I didn't know Big Pharma, how that all worked.
Yeah.
Now I got you to tell me what I should basically
Yeah.
be putting in my body, what shouldn't.
Basically.
So, yeah, dude, holy shit. Yeah, if that shit came out, like, this year then,
Hmm.
I probably wouldn't do it.
Yeah. I mean,
That's
it's all
crazy.
it all depends on your like because there's certain biases that come out. Like
Yeah.
there's certain like
And it's so
yeah.
like and like you were saying before, I didn't mean to interrupt you,
Yeah, no, you're good.
but like with like marketing saying like, oh, here, COVID vaccine, take this and you won't have COVID and
Yeah.
you'll be clean from COVID.
Right.
How many people are gonna easily just believe those words and do it?
Because this is
So
what this is where the marketing scheme becomes an issue
yeah,
because they can say that they
yeah,
can say, oh, take this COVID vaccine
yeah,
and you'll be fine.
yeah,
Then they're gonna put in like the fine print. Not
yeah,
everyone will be fine.
yeah. And nobody's gonna zoom in to see that.
Exactly.
So
That's how
yeah, it's
marketing works.
crazy. Yeah, it's marketing 101 for you.
Yeah.
It's like, what do you mean? It is on print. And yeah, it's true. But the big bold words are what people see in that tiny little sentence.
Like for example, Ozempic. They're not. So in big, it's gonna say weight loss drug, weight loss
Yeah,
drug. In the small, it's gonna say not a direct target of weight loss
yeah,
because certain people won't lose weight.
yeah,
They're just gonna have lower glucose levels at this
yeah.
point. That's all it's gonna be.
And it's even crazier because you brought up like Oprah, and then you got all these like powerful people
Yeah.
in the world that like people think they're God, and it's like they're gonna
Hmm.
follow that too.
Exactly. And they're paid to endorse it,
Yeah,
which means that
that's
either
insane,
either
dude.
Ozempic didn't make Oprah pay for it, or they paid Oprah, or like basically they like for the drugs or whatever.
Yeah,
Obviously, you got to pay for the drug, right?
yeah,
But certain companies will be like, "Oh, Oprah, if you take the drug, you got it. You can take it for free, right?
yeah.
All you
Have
got
a
to do is just
lifetime
endorse
supply
it."
or whatever.
Yeah, right.
Damn.
But then, or there's like you got to pay for the drug, but we'll pay for you to talk about it.
Yeah. Damn, dude, that's crazy.
Yeah.
So then, what about like big pharma with the whole opioid thing?
Oh man, dude, the opioid crisis is really bad.
So
Um.
what's with that and big pharma?
So
I know there's some show about it on Hulu. I forgot
yeah,
the name of it, but
I gotta watch that because like
I've
now
only
that
seen certain clips. But
so I don't know too much about it. All I know is that the opioid crisis is very bad right now,
yeah,
as in like heroin,
yeah,
like all like these big big drugs that you could think of.
yeah.
The main point of the opioid is to attack your GABA receptor or your opioid receptor, and your opioid receptor is what is released for dopamine response or like released for um pain response, right? So
Okay.
if you attack it, or as in you inhibit it, then you're not gonna have any type of pain. It's a pain reliever,
Okay.
right? But it's so addictive because of the effects that happen when you bind to the GABA receptor, essentially,
Hmm.
right?
Okay.
So, and also, it all depends on the potency of the drug.
Yeah.
These opioids are the most potent that you can get when it comes to drugs. So you can take a little bit of it and you'll be more than enough. You'll be fine, right? But certain doctors or like certain patients or like certain like any pharmacist or anybody
Yeah.
that's is selling this stuff,
Yeah.
they either it's a honest mistake or like they're getting paid extra to do it,
Mhm.
but they're prescribing a higher dosage of it, which means that you're gonna get a better high from it. Does
Okay.
that make sense?
Okay.
So like
So then, what kind of people are these prescribed to then? Like people with depression, anxiety?
opioids,
Yeah.
any people that got surgery, basically.
Surgery. Okay.
Anytime you have like really high levels of pain,
Okay.
that's what it's for.
Okay.
Yeah. But they have secondary responses as in
Hmm.
like it makes you feel less depressed. It makes you feel less anxious,
Okay.
stuff like that.
Okay. And then that's where people get wrapped around it, where it's like, oh, it's making me feel good. I want to keep buying more.
Exactly. And then the addictive nature is because of how potent it is.
Gotcha.
So which means that if you take so much of it, like
Hmm.
for example, if I pinch you just a
Yeah.
little bit, right?
Yeah.
You're not gonna feel that much of it, right?
Yeah.
That's just me giving you a little bit of it.
Mhm.
But if I pinch you really hard,
Yeah.
you're gonna feel it. You're gonna feel it, and you're gonna feel it for a while,
Yeah.
right? But if I pinch you a little bit, you're not gonna have that feeling ever again. Which means that you're gonna have a higher amount of
A
pinch,
higher high and
higher high. Does
yeah.
that make sense? So that's the analogy I give
Mhm.
to help people understand that like with opioids is that it's such a potent drug
Yeah.
that if you expose yourself to such high numbers, you're gonna keep going higher, 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 which causes
Yeah.
overdose.
Damn.
That's how that works.
So then, how are like, where does it come in with Big Pharma being wrapped bad around this? Because they
Yeah,
keep like just giving it to
endorsing
these
it.
people.
They keep endorsing it. They keep saying, "Oh,
Okay.
this is the best option," when
Gotcha.
it's not the best
When
option.
obviously there's a whole entire crisis going on about it, but they keep saying it's the best option for
Exactly.
post surgery.
Which there's other drugs that came out which you don't need, which means that you don't need the opioids anymore. You can
Yeah.
take hydrocodone, you can take oxycodone, you can take all of these drugs that you can think of that are not that high level.
Yeah.
Also, you can, and they also really good doctors will tell you only take it when you have pain or like when you absolutely need it.
Yeah.
And I'm gonna prescribe you this much, and that's all you're getting,
Yeah.
right?
Kind of deal with the pain as much as you can before it's unbearable. Then you got to take it.
Exactly. So
Okay.
that's what good doctors will do, and
Yeah.
that's what healthcare is trying to teach you,
Yeah.
like specifically medical school and like undergrad, like the
Yeah.
class I'm taking. That's what they're trying to teach you.
Yeah.
But then obviously big pharma comes into play because that's how you get paid.
Yeah.
It's through big pharma and through these insurance companies, right?
Yeah.
So your job is to bill the insurance company as much as possible so then you can get a good number.
Mm.
That's where the healthcare system gets so messed up
Mm.
because now at this point you're fighting for your life to pay like to make ends meet,
Yeah.
to like pay for your house, to pay for your mortgage, to put food on the table.
Yeah.
But at the end of the day, at what cost are you doing that?
Yeah.
That's what
Making a drug that's killing people.
or like selling a drug.
Yeah.
At this point, you're a drug dealer when you're a doctor.
I don't like you anymore. I'm
Hey,
fine.
that's how it is, bro. Yeah, so that's what it is
Damn, that's
basically.
okay. That's crazy.
Yeah. So that's why opioid is really big right now, and like
Yeah.
why big pharma is getting a huge
Fentanyl's part of that.
Fentanyl, yes, it's huge.
Yeah.
Like all of like these ones that have you seen like for example like crackheads or like
Yeah.
these people on the streets where they're literally like foaming at the mouth.
Yeah.
That's what that's from. It's from the fentanyl poisoning or
Damn.
like heroin poisoning stuff like that. Um,
That's insane.
yeah,
We're at an hour and 24, hour 25.
yeah, but it didn't feel like that at all.
I did not. That's crazy. Dude, you blew my fucking mind tonight. I'm not gonna lie.
Yeah. Hey,
That's
anytime, bro.
insane.
We can do this every weekend now.
That's insane, bro. Shoot, let me know.
Yeah, bro.
I'm off Saturdays,
Yeah,
Friday nights, Saturday nights,
works for me.
but I work 5 a.m. on Sundays.
Oh, that sucks.
Yeah, so
That
like
sucks.
right after you leave, I'm gonna like shower and lay down, dude. So yeah,
Yeah, what time is it right now? 8:48.
yeah,
Yeah, so I'm probably just gonna go to the place here and pray over there.
yeah.
But yeah, bro. Like, look, I'll think of a topic for next week, and then we can ask me questions from there, and I can answer to the best of my abilities. I'm not gonna try to make something up to make myself sound smart.
Yeah.
I'll obviously do my research and all that
Yeah,
stuff. You know what I'm saying?
Yeah, only tell me what you know for
Yeah,
sure.
exactly.
That's
But yeah.
crazy.
So
My mind is blown.
first one back. First one back.
That was a banger of a topic, dude.
Yeah?
Yeah, dude.
We'll think of something even better next week.
Yeah. I'll probably get this thing uploaded sometime tomorrow. Probably
Yeah.
not the 1 a.m. sharp.
1 p.m. or whatever it is.
Because
Yeah,
I get out of work at 1:30.
that's fine.
So I'll probably just get home and edit everything.
That's cool.
So
All right.
it is
Well,
what it is.
see you next week.
See y'all next week.
Peace.